Today we are going to see the distractors in the NCLEX type questions. The distractors are mainly the wrong options, may sound correct at first glance. It may be partially truth type of answers, or it reflects the common nursing mistakes. Mainly it tests the prioritization, the safety and the judgment in the NCLEX type taking questions. There are many types of distractors. We are going to see the few things. The partially correct answer. It contains the true statement, but only it doesn't address the question fully. Example: the assessment may be correct, but it is not the priority we are going to see. Next one is coming to the point where the NCLEX wants the best answer, not something which is right one. Next distractor is the unsafe and the risky actions. Here we have to see the intervention that could harm the patient, often violate safety, infection control and ABCs. So we have to always put important which is the factor that puts patient under risk. This is the distractor we have to see. Next type of distractor is scope of practice of errors. The action should not perform. Which action the nurse should not perform? This task needs to be delegated. Which task needs to be delegated to another profession? And the nursing diagnosis which is being prioritized instead of assessing. So coming to the next type of distractor, medical versus nursing interventions. Here the NCLEX wants to always assess the independent nursing action first in lieu of the medical actions which we are not authorized such, where the nurses mainly emphasize on the physician focused actions like order the medicines, order the investigations which are not of the scope of practice by the nurses. So we have to emphasize on the type of nursing care which is prioritized. Next one is the too general or too specific. We are going to answer the questions. Here is like we are selecting the vague answer which is not the correct answer. Like monitoring the patient closely doesn't require in case of emergency, where we need a quick assessment and we need to take care of the patient immediately. And next one is overly detailed action is not appropriate at that moment. I have given an example in time of emergency. Next type of distractor is the wrong priority. We always assess the wrong priority, like the correct interventions which is done at the wrong timing. Example, in the case of emergency, we are ignoring the ABC, that is airway, breathing and circulation, or the Maslow's hierarchy. We are going for the psychological aspect which is not important at this point of time. Next type of distractor is we have to see for the absolute words which is mentioned in the NCLEX questionnaire, like always, never, all or none. Usually these type of words which is clearly not justified, this may be not the right answer. Next type of distractor is emotional or non-therapeutic responses, like we are sound caring, but it is not a therapeutic approach to the patient. For example, we address the patient by saying don't worry, everything will be fine. This is not the thing. The type of therapeutic response which is we are going to satisfy the patients. So these are the type of distractors which are mainly seen in the NCLEX style questions. Thank you.